Hello and welcome to our group presentation for UIO. This is the organisational context of Headspace, and presenting this presentation is myself, Jessica Harris, Natalie Tanti, Agnes Umatoni, Charlotte Craig and Melissa Liliano. Hello. We would like to start this presentation by acknowledging Aboriginal Australians as the traditional owners upon the land on which we meet. We acknowledge and pay respect to the elders, past, present and emerging. My role in the interview was to discuss the inception and history of Headspace with our social worker. Before our interview, I was able to learn from the website that Headspace is a non-governmental organisation, or an NGO, that was established by the Australian Government in 2006. It was originally called Headspace National Youth Mental Health Foundation and was established to address the significant gap in services by providing tailored and holistic mental health support for 12 to 25-year-olds. In our interview, I asked what they could tell us about Headspace's growth from its inception to what it does now and how it has changed and evolved over time. Our social worker explained that Headspace was initially set up by Melbourne University in 2006 in a bid to address mental health issues and is vastly different to what it is now. In 2008, it became independent from Melbourne University and became a company by limited guarantee. Initially, Headspace planned on having only 30 centres nationwide. It very quickly grew and now has about 137, and this figure changes almost daily. Headspace's original idea was to have just the centres for clients to access, but it now has national online and telephone service, digital mental health programs, in-school programs and e-Headspace. It also provides different vocational services. Next, I asked our social worker what Headspace does now that it didn't do 10 years ago, and why it evolved that way. They explained that Headspace has always been driven by their why, which is young people. Everything that Headspace has done, it has been initiated, driven in conjunction with young people. Every centre has a national youth reference group where young people come together to guide the decision making. It is an integral part of their organisation. Young people have guided their growth, and Headspace wanted to be everywhere that young people were. Our social worker emphasised that an area of growth over the years has been in raising awareness of youth mental health. She said that they were very proud of the awareness that had come from years and years of advocating for youth mental health. They pointed out that the Take a Step, which is for Aboriginal and Torres Strait people, was one of these examples. They mentioned that young people are looking for help at unprecedented levels. They have to continue to get smarter about awareness raising. The next question I asked our social worker was how she saw their history as being important to the organisation. She said that a lot of young people were involved and were the original members of the team, and they had been integral to making Headspace what it is today, and they have now gone on to work in the field themselves. She said she has learnt from these people over the years, highlighting the integral role of young people at all levels of the organisation. She highlighted that the reason she has stayed so long at Headspace is based on the ecological model, that is, looking at how a person fits into the environment that they live and how the environment affects them. Examples of this are things like policy changes, increased government help around mental health and big system reforms. All factors continue to change, and therefore Headspace will continue to evolve with it. Our social worker commented that this has been very encouraging to see. She was also very impressed with the way that Headspace has dealt with the growth and consolidation balance. Having to adapt to these changes has been challenging. However, she feels for the most part they have done well to keep up. She confessed that some areas of Headspace, however, had been delayed, like having a workforce strategy, and an early career program is only just being implemented now. She also highlighted that Australia has a shortage of mental health professionals. Metaphors help us to understand how organisations operate. The metaphor of an organisation being downstream means they tend to go with the flow. However, organisations can also operate in an upstream manner, meaning that they advocate for change and challenge the status quo. Headspace has operated in a downstream manner by providing services that are in line with government policy. Headspace works in schools providing programs such as School Suicide Prevention Activities Program in line with state government guidelines. However, Headspace has operated in significant upstream ways, such as being a voice of change, advocating for better services and recognition of youth mental health challenges. It has been through the voice of these young people that more services have been provided and pressure has been placed on government for more funding and better services. A further metaphor for Headspace is flux and domination. Hughes and Waring describe flux as an organisation that is constantly changing. Social workers and other healthcare providers have to constantly evolve and establish different and varied ways to reach out to young people. An example of this with Headspace is the enormous input their service users, the youth, have to decisions that are being made every step of the way, from the decor of their shop fronts to policy decisions made at executive levels. Youth continue to guide and change the way Headspace provides services. They have also had to work out how to best provide these services, which is constantly changing. Domination can refer to the dominant decision and policy makers within an organisation. For some organisations, this might be board members and management, and for others, it may also include the service users. Headspace, as we know, makes decisions that extend from the board to the executive team to social workers to the service users themselves. The service users themselves have contributed enormously to what Headspace ultimately does.
Mission at Headspace. Headspace collaborates to design and deliver innovative ways of working with young people to help strengthen their mental health and well-being. Vision. All young Australians are supported to be mentally healthy and engaged in their communities. Values of Headspace. Their values are inclusion, collaboration, agility, and excellence. Inclusion. Headspace strives to create a welcoming, safe, and inclusive environment for their staff, and they firmly believe in the strength of difference. Collaboration. Collaboration with staff and other organisations to work together to deliver great outcomes for all young people. Agility. They employ an agile and innovative approach and are constantly learning and growing so that they can deliver the best services for all young people. Excellence. They hire dedicated and passionate individuals who are empowered by the organisation to provide the highest quality of service. Importantly, excellence is inclusive of the process of personal and organisational reflection. Values of The Headspace Way. A great example of these values and the mission being evident in the organisation was the creation of the Headspace Way in 2018. This is the culmination of their vision and values. Staff were given the opportunity to share with senior management and the executive team what was working and what wasn't. More importantly, they were able to discuss how they wanted to collaborate with each other inside the organisation. They also incorporated an activity which centred around Headspace's history and what the team had accomplished so far, which was very well received by staff, particularly those who may not have known as much or had not been at the organisation as long. There is a great short video on their website which shows how this process was done. So mission and values at Headspace. So how does a social worker incorporate the vision and mission into her day-to-day practice? Young people are what the organisation is all about, and therefore they are always collaborating with the organisation in various ways. The social worker encourages this at every level within the organisation, which is particularly important as she is in a position of leadership. In her role, she has found that leadership allows her to share her passion for young people's mental health with others. More specifically, one of her departments is aimed at improving training and education at Headspace, so she is able to ensure that the mission of the organisation guide both this department and her leadership. Is it important that the organisation's values align in some way with your own? The social worker agrees that it's imperative that the organisation's values align with your own in some way. She notes that there has been a shift for the better in social work practice in the last 20 years, as there didn't used to be an emphasis on values-based organisations like there is now. The social worker particularly aligns with the action agility value at Headspace. So does the culture at Headspace reflect the organisation's mission and values, and in what ways? By having two effective leaders, the CEOs, who embody the mission and values themselves, that then trickles down through the company, specifically focusing on the culture within the company. The social worker has verbally heard multiple employees note that it's clear that the workers care about each other at Headspace. She's also noted that people bring their whole selves to work each day, and it is evident in how they interact with each other at work. In relation to the mission, what innovative methods does Headspace use to connect with service users? They work with 3 different youth advocate groups, including the Headspace Youth National Reference Group, known as HYNRG, the Australian Youth Advocates for Mental Health, and the Woman Jenka Group, which is an Aboriginal and Torres Strait Islander group. They help inform and guide services and programs that Headspace offers. What's great about this is that they ensure that they are always working with their mission in mind, collaborating and working with young people to deliver services that strengthen their mental health and well-being. They also make sure that what they are providing is something that young people actually want to engage with. They are also inclusive of First Nations people to help offer culturally safe services that Aboriginal and Torres Strait Islanders feel safe using. An example of their continued collaboration with Aboriginal and Torres Strait Islander youth launched on the 16th of August. It's the Take a Step campaign, which was in collaboration with the Woman Jenka Group. Again, there's a great video of this campaign on their website. So mission, values and vision and metaphors. So when talking about Headspace and its mission, values and vision, it's possible to view Headspace as 2 different metaphors. So we have organisation as lenses. So from the information the social worker provided to us, it's easy to see that how Headspace can be viewed as a lens. When discussing the vision, mission and values, we are looking at the organisation's culture and how that influences communication, but more importantly, how it has impacted the decisions that the organisation makes. It is very evident when speaking with the social worker how important youth are when discussing decisions and the organisation of Headspace. So we also have organisations as a living organism. So the focus in this metaphor is on organisations' ability to adapt with change occurring around them. Further, from a systems living perspective, organisations involve their employees in a highly interactive way and are able to share their opinions and have influence over decisions that are made at the organisation. From our discussions with the Headspace social worker, and after a review of the website, you can see that youth have a strong influence on the decisions that are being made within the organisation. So mission, values and
I'll be discussing governance at Headspace. So prior to the interview, we looked online and there was not enough information regarding governance. So all of the information I'll be discussing is from the interview we did with the social worker. So we learned that the Commonwealth and the states and territory governments fund Headspace and they have an ongoing relationship. So the executive team at the Headspace has fortunately meetings with the health department in regards to big projects. They also have quarterly meetings in regard to different information and reporting requirements. So the social worker stated that they have really a great relationship with the department. However, the staff turnover at the health department is quite high, which means that Headspace had to constantly start over, which can be very frustrating. Despite this, Headspace has a strong bipartisan support from both major political parties. Outside funding, the federal government does not have a role in governance of Headspace except to confirm the board chair. So to be a board chair, you will need to go through the job application and be interviewed, and be confirmed by the government. So Headspace has its own constitution, as Jesse has stated earlier, that the Headspace became a limited organization by guarantee in 2008, and that's when the constitution came into place. So this constitution governs the organization and set out all the processes. Headspace has a board of governance made by board of directors who are elected by members. So the board make decision regarding the direction of Headspace. So within the members, which Melissa will discuss in details, it is worth to note that the Australian Psychological Society and the Australian General Practice Network are still affiliated with the Headspace, even though they are not currently members. So in regard to other decision making, it really depends on what decisions are being made. So Headspace has like two governance structures. So they have a corporate governance and a clinical governance. So from a legal point of view, they are both accountable. Each one is accountable because they are making decision from the department, which can be confirmed by the board. So the social worker we interviewed is in the clinical governance department. In regards to advocacy, it is mostly done by the executive team led by the CEO. So the Headspace has a division called Strategy, Impact and Policy, which makes policies and grant application. This will also respond to, will make, application regarding advocacy to policymakers. This division is informed by the workers on the ground. Headspace also has a youth advocate team, and the family and friends of service user are also involved in the advocacy. I will now be discussing policies and the legislation that guide service delivery at Headspace. So while there was nothing concrete about registrations on the website, Headspace, being a mental health organization, is guided by Mental Health Act, so both from federal and state and territory governments. So in the Victorian context, we could say that Mental Health Act 2014, Children, Youth and Family Act 2005, Drugs, Poison and Controlled Substance Act 1981, just to name a few. And given that other states and territory fund Headspace as well, so there will be other relevant registration in those state and territory, as well as other registration they will have to comply in the Victorian context. So from internal policies, so on the position policy, as I said, on the policy position, as I said, Headspace has a division called Strategy and Impact Policy, and this one will be involved into advocacy and lobbying government in regards to policy change. So as I said earlier, they are informed by workers on the ground, so they will know what's required and they will lobby the government to change the policy. On operational policy, so Headspace has different operational policy. We could find one on the website, the privacy policy, but also another example we discussed with the social worker was the complaint policy. So the social worker we interviewed is in the department that manages complaints.
Organizational structure can be defined as a system that outlines how rules, roles, and responsibilities are delegated among the workforce in order to achieve the goals of an organization. Additionally, organizational structure also determines how information is passed on between levels of a company. Headspace takes a hierarchy approach to the structure, connecting multiple management levels within the organization. Therefore, the decision-making process is formal, flowing from the top to the bottom. As illustrated in the figure above, the organizational chart of Headspace gives us an idea about the size and structure, how departments and teams relate, and further provides insight to the governance of Headspace. The Foundation Executive Committee and the Advisory Board are the two primary governing bodies of Headspace. The Foundation Executive Committee encompasses representatives from 5 founding organizations: Origin, Brain and Mind Research Institute, Australian Psychological Society, Australian General Practice Network, and the University of Melbourne. The Advisory Board is comprised of community members with a range of expertise that provides guidance regarding the strategic direction of Headspace. The Chief Executive Officer is also central to the governance of Headspace. This position reports to the Foundation Executive Committee and the Advisory Board on the progress of all initiatives. The Chief Executive Officer is also responsible for overseeing the National Headspace Office and all other subcontracts, such as the Centre of Excellence, Community Awareness, Service Provider, Education and Training, and Communities of Youth Service. The Headspace National Office plays a large role in branding and marketing within community awareness campaigns. They are also responsible for holding meetings with the mental health directors from each state and territory within Australia. Another element of the structure of Headspace is records. Records within Headspace are held in various ways, ranging from annual reports, evaluations, and budgets, to personal files, case notes, and reports. Reflecting the oldest organizational theory established by Frederick Taylor in 1911, the machine metaphor is used to demonstrate how organizations operate in relation to their organizational roles, rules, policies, governance, and structure, and how that influences the operation of the organization itself. The mechanical perspective also tends to focus on the efficiency and process of the organization by breaking down multiple systems such as complexity, formalization, and centralization. As Headspace has a variety of multidisciplinary teams and various occupational specialists working to create a better future for young people, such as psychologists, psychiatrists, mental health nurses, social workers, and mental health recovery and rehabilitation workers, this illustrates high complexity with a high number of resources in divisions, teams, and projects, and a wide range of available services. Additionally, as each role is clearly assigned, enabling rules for expected behavior to be articulated and followed, this indicates high formalization. It also attempts to ensure the structure of relationships within the workplace is explicit, clear, and visible. Finally, centralization is the degree to which formal authority is concentrated in one level of an organization. Therefore, as activities pertaining to planning and decision-making are held within the National Head Office of Headspace, reflecting a classic hierarchy as previously mentioned, this demonstrates high centralization. The success of Headspace. The success of an organization largely depends on its management structure. Therefore, to ensure the organizational structure of Headspace is performing in the intended way, evaluations and measurements of success are necessary. The social worker we interviewed revealed that there are various contracts and deliverables that Headspace is measured against. One of the main indicators that gets measured is the wait time reduction program. To go into more detail, $152 million over an 8-year period was distributed across the network centres with long waiting lists. Following this, reports are conducted monthly and sent to the Commonwealth surrounding the waiting times of these services. This funding aims to increase Headspace Centres' financial stability, to allow better development and provision of services, and to increase access for young people to ensure they get necessary support in a reasonable time. The distribution of funding among multiple clinics demonstrates how much difference has occurred as a result of funding. If major positive difference has occurred, meaning a reduction in waiting times, this illustrates that the organizational structure of Headspace is flowing and performing in the intended way. Additionally, this illustrates effective communication, cooperation, and efficiency within the workplace, further reflecting success of organizational structure of Headspace.
Headspace run a range of different services that help and support young people in various aspects of their lives. There are 4 primary centre services provided. Firstly, mental health services are offered, including counselling, providing mental health plans, treatments and support, as well as the early psychosis program. Secondly, there are physical health services, including sexual health, telehealth, and GP services for treatment and medical advice. Thirdly, alcohol and drug services are offered for treating addiction and providing counselling and education, which seeks to address complex circumstances surrounding substance abuse. And lastly, vocational services are offered, like career mentoring programs, which help provide young people school and work opportunities, as well as services relating to coping with job application and workload stress. Headspace run a range of multidisciplinary teams. Multidisciplinary teams are common in service delivery at Headspace, often with 4 to 5 disciplines coming together to collaborate. These could include GPs, psychologists, social workers, and other health and human service professionals. When asked what she deemed social workers offered to services and collaboration in multidisciplinary teams, she gave an interesting response. She described how she was often tired of having to justify the purpose of social workers amongst other health professionals, a sentiment that resonated with many of us as students of social work. She explained that within teams, social workers can be often undermined or questioned regarding what they bring to the table. Furthermore, she discussed how as social workers, we offer clinical skills, organisational skills, and investigate the whole system and context of people's lives. Social workers' contribution and knowledge regarding family work and interventions was especially highlighted, as she recounted situations where she carried out parent and family assessments that other health professionals lack knowledge about. She described how social workers have a holistic in-context approach, where questions about their life and were asked in relation to the wider societal circumstances that affect them. Multidisciplinary teams. Multidisciplinary teams are common in service delivery at Service evaluation. In terms of how services are assessed, the social worker explained that services are typically internally evaluated using qualitative and quantitative measures. She highlighted how young people's opinions and input are at the forefront of the decisions made relating to service delivery and essential in improving and creating services. Interviews and surveys on iPads at centres are utilised to gain feedback, with follow-up questions always being provided. At the Headspace locations, the model integrity check is used to involve young people on both a service and governance level, by always having a young person sit in on discussions regarding service delivery. They also have a say in how the Headspace centres are set up, with a youth reference group creating and designing the space. The social worker also highlighted how the Service Innovation Project is another effort Headspace makes to improve services, which aims to develop the best approaches based on up-to-date evidence to better the effectiveness and quality of service. Components of the project include identifying the most beneficial practice framework, engaging in the social inclusion model, and implementing centre demonstration projects where service approaches are tested. Cultural safety and inclusion. As previously mentioned, Headspace discusses how the social inclusion model works to create a culturally safe and inclusive space as it examines the social barriers that prevent multiple diverse populations from interacting with services at Headspace. These people include people from linguistically or culturally diverse backgrounds, Aboriginal and Torres Strait Islanders, and LGBTQI+ people. In terms of migrants and refugees, the social worker discussed the launch of the Culturally and Linguistically Diverse Project, which aims to provide support to communities. In particular, she highlighted how the Bankstown location was a particularly welcoming centre with a very culturally diverse staff who were key advisors in the project. For Aboriginal and Torres Strait Islander peoples, she described how model reviews are carried out that ask communities what they think works, what doesn't work, and where and how they can make changes to services to be more inclusive, culturally safe and appropriate. Yarn Safe was another camp. Rainbows and Glitters campaign, which addresses the difficulties many young people face when discovering who they are. Empowerment, as well as hearing stories from other LGBTQI+ youth, are important to Headspace in creating a safe space where young people do not feel alone. Q Headspace chat sessions, as well as other queer social groups, are also there to provide a means of connecting LGBTQI+ people to community. The social worker also spoke about their engagement in Mardi Gras every year, creating a fun and inclusive environment for young people. She also mentioned how a large cohort of the Young People's Reference Group are members of the LGBTQI+ community, providing representation for decisions.
So what's our reflection after the interview? So first I will discuss from a service user point of view. So while we could not attend the Headspace office due to COVID restrictions, what we took away from the interview is that young people are at the center of everything that Headspace does. So they are involved in everything from decorating the space to providing feedback about the services. So as we looked on the website, we found a video where young people were discussing how inclusive and welcoming the Headspace clinics are. From the video, we could see posters on the wall with inspiring messages. Unfortunately, because we're not there physically, we could not see if it was in different languages, so we don't know if it caters for everyone. But it's important to note that they were talking about how they are treated like individual and no numbers, and that's really important for a service user to feel included and respected and valued. So from a social worker point of view, we were blown away by what the social worker was saying, how positive it is to work there. We could sense her passion for young people, and she sounded really satisfied with her work. So the social worker made the really compelling evidence why social workers are vital in mental health services, given the knowledge of the person, environment, the societal structure, and the impact on the person. We felt very excited to want to work for Headspace, as the culture and the collaboration between teams sounded really good. It is also worth noting that she mentioned that she's been there for more than 7 years, and given the burnout in this sector and the high staff turnover in many in the sector, it's really pleasing to note that at Headspace, as a social worker is valued and satisfied with the work they do. So thank you very much for watching the presentation. We hope you learned as much as we did, and we hope you enjoyed it. Thank you.